Welcome back to Capsa, your ultimate guide for everything pharmacology. In today's video, we are breaking down Zofran 4 mg or Ondansetron, one of the most commonly prescribed medication for nausea and vomiting. Here is what we will cover: what it is and how it works in your body, who should take it, and just as importantly, who should not. We will go over exact dosing guidelines to help you see or use it safely. You will also learn about potential side effects from mild to serious ones. And I will end with practical safety tips and answer to your most frequently asked questions. This video is packed with information to help you understand Zofran inside and out. Whether you are a healthcare student, a medical professional, or just someone curious about their medication, you are in the right place. So stick around, because by the end of this video, you will have all the answers you need. Zofran, also known as Ondansetron, is a medication primarily used to prevent nausea and vomiting. It belongs to a drug class called 5-HT3 receptor antagonists, which work by blocking serotonin in the brain and gut. This makes it particularly effective for nausea caused by chemotherapy, radiation therapy, and post surgery recovery. The most commonly prescribed dose is 4 mg, which we will focus on this video. Let's break down at the molecular level to understand how Zofran works. When your body is exposed to triggers like chemotherapy, surgery, or radiation, it causes cells in your gut lining to release serotonin, a chemical messenger. Serotonin then binds to specialized receptors known as 5-HT3 receptors located in two key areas. First one is in the vagal nerve endings in your gut. Second one is in the chemoreceptor trigger zone or CTZ of your brain, which communicates with the vomiting center. This binding activates a cascade of signals that ultimately lead to nausea and vomiting. Zofran or ondansetron works by selectively blocking the 5-HT3 receptors in both the gut and the CTZ. It acts as an antagonist, preventing serotonin from binding and activating these receptors. This mechanism stops the signals from traveling to the brain's vomiting center effectively, interrupting the vomiting reflex before it starts. By targeting both peripheral and central receptors, Zofran provides dual protection, making it highly effective against nausea caused by conditions like chemotherapy or surgery. This selective action is also why Zofran does not affect other serotonin pathways in the brain, limiting side effects compared to older antiemetics. Now let's talk about why doctors prescribe Zofran. It's primarily used to manage nausea and vomiting caused by chemotherapy, radiation, or surgery. Additionally, it's often used off label for other conditions such as morning sickness in pregnancy, though there are some safety considerations we will discuss later. It can also help with nausea from migraines or alcohol withdrawal, though always consult to your healthcare provider before the use. The recommended dose of Zofran depends on the condition being treated. For chemotherapy-induced nausea, a single dose of 4 mg can be given orally or through an IV before treatment, followed by doses every 4 to 8 hours. Post-surgery nausea is treated with a similar dose, often administered just before anesthesia. Pediatric doses are usually weight-based, so consult your pediatrician for the correct amount. Like any other medications, Zofran can cause side effects. Common ones include headaches, constipation, or mild drowsiness. However, more serious risks such as QT prolongation, a heart rhythm disorder, or serotonin syndrome are rare but possible. Patients with heart problems, pregnant women, and those with liver disease should consult their doctor before using Zofran. Here are answers to some of the most commonly asked questions. First one is, how quickly does Zofran work? So Zofran typically starts working within 30 minutes to 1 hour when taken orally. For intravenous use, the effects are almost intermediate. This makes it an excellent option for fast relief of nausea and vomiting. Second question is, can I take Zofran on an empty stomach? Yes, Zofran can be taken on an empty stomach and it won't affect how well the medication works. However, if you experience any stomach discomfort, you can take it with food or as advised by your doctor. Third one is Zofran safe during pregnancy? Zofran is often used off label for treating morning sickness, particularly in severe cases like hyperemesis gravidarum. While studies have shown mixed results, most doctors consider it safe during pregnancy if prescribed. Always discuss risks and benefits with your healthcare provider before taking it. What happens if I miss a dose? If you miss a dose of Zofran, take it as soon as possible or as you remember. However, if it's almost time for your next dose, skip the missed one and stick to your regular schedule. Do not double the dose to make up for the missed one. Can I take Zofran with other medications? Zofran interacts with certain medications, including antidepressants, antiarrhythmic drugs, and others that affect heart rhythm. Always inform your doctor about all the medications or supplement you are taking to avoid harmful interactions. Does Zofran causes drowsiness? Zofran is less likely to cause drowsiness compared to other antiemetics, but it can happen in rare cases. If you feel sleepy or dizzy after taking it, avoid driving or operating heavy machinery. I hope this video answered your questions about its uses, dosage, safety, and more. If you found this helpful, please hit it like button and subscribe and share it with your anyone who might benefit from this information. Drop any questions or video suggestions in the comments below, and I will see you in the next video. Thank you.